Welcome to Ultrasound Physics Lab Session 2. Today we're going to dig a little deeper into the knobology we looked at last week and also examine some new functions. Let's get to work. Okay, we're back to scanning my partner Joe here. But before we start, I'd like to show you something very important. Every transducer on one side has a notch. See, these have it too. Not the little circle, but the notch. Some of the machines look a little different, but it's the same thing. This is your orientation marker. On your screen, this little mark here corresponds to the notch. The Siemens Acuson has a A. The Toshiba has a T. It always starts off when you boot up on the wrong side. You got to change the left-right on this one here. There we go, that's better. And of course the GE Logic S7 has a LS7. See, in this notch, if you touch right by the notch, you're always touching right by that notch, right by that dot on the screen. So, when I'm scanning Joe here, I always have this notch in the sagittal view up by his head. The sagittal views are just like you took the patient and sliced them down the middle and looked at him from the side. Okay, so here's my patient Joe. Here's the orientation marker right here. The head is up here. So here's the heart, here's the diaphragm, here's the liver. So I have the notch or the orientation marker cephalad or towards the patient's head. The transverse views are like we chop the patient in half and looked at him from the bottom. So in the transverse view, we always have this notch to the patient's right. So in this transverse image, you see the orientation marker is on the patient's right. This is the liver. This is the right lobe of the liver. This is the left lobe of the liver over here. And there's a portal vein with some color Doppler. Okay, let's review our controls again. Okay, here's our familiar control panel. Here's the freeze button, the print button, and the gain. Keep in mind that different machines have different labels for their knobs. For instance, on the GE, the freeze is a couple arrows. This one has a snowflake for the freeze button. Get it? Freeze, snowflake. This one says freeze. Here's another snowflake. Print button. On the GE, it's P1. Still store. Acquire. What about gain? On the GE, it's B for B mode. All the rest say 2D. But it's all gain. How about the output power? This one has a P. In reference to output power, there have been no confirmed adverse biological effects to humans using diagnostic ultrasound. A fetus or an embryo would be the most sensitive to bioeffects from ultrasound. The OB packages have appropriate power levels, so when performing exams on these patients, make sure to be in the OB package. What about frequency? Frequency goes by a few names too. On the Siemens, they call it multi-hertz. Here's another frequency. On the Philips, they don't have a power or frequency knob, but they have this 2D optimization. And you pick penetration, high res, in general. Presumably, it includes frequency and power. Okay, back to the freeze button. Pretty simple, right? Freeze, unfreeze. The freeze button has a great feature. It's called freeze scroll. Let's say you're trying to measure a common duct. See this little tube here? That's the common duct. But let's say your patient's moving around, he can't hold his breath, it's hard to get it. What do? Well, you freeze, and then you scroll back. You scroll back until you get a nice shot. The machine stores the last few seconds so you can get back to it. You use it all the time in almost every study. It's especially useful for OB when you're trying to measure something a couple millimeters in a fetus and the fetus is jumping around, or pediatrics where they have a hard time standing still. Another thing you can do is instead of hitting freeze, you can record a clip. So to record a clip, you just, instead of hitting freeze, you hit P2. And then use your trackball and your cursor and you click on it. And there you got your clip. Okay, let's talk about zoom. Okay, zoom. Pretty straightforward. You just freeze an image and then you zoom in on it. Looks kind of pixely though. When you zoom in on a frozen image, it's called read zoom. What works better is right zoom. With right zoom, you zoom in first while you're scanning. A lot better resolution, a lot less pixely. Okay, let's examine dual screen. Okay, here's your control panel. We have the freeze button, the print button, the print clip button. You got your gain right here. What are these two little things? That's dual screen. There's a left and a right. Okay, here we are looking at the popliteal vein. It's the big blue one. Okay, let's take off the color. Let's hit the right. Now the right side of dual screen is live and the left side of dual screen is frozen. Let's compress it. Then we freeze, and here we've demonstrated that the popliteal vein here is open. Here we've compressed it, so that proves that there's no clot in the vein. That's dual screen. Okay, next, let's talk about the depth control. Okay, depth, pretty simple. You just click the depth control, and you increase the depth of the image. It's not that simple. It's simple to do, but there's a lot going on when you do that. When you increase the depth, you increase the pulse repetition period. What's the pulse repetition period? Well, here's a pulse, and this is time. For a short period of time, you have the pulse, and then for a long time, the machine listens until it sends another pulse. The time from the beginning of one pulse to the beginning of the next pulse is the pulse repetition period. When you're imaging at a shallow depth, the machine sends out a pulse, the pulse gets back, and sends out another pulse, the pulse gets back. But when you're imaging at a deeper depth, and you have to turn up the depth of the machine has to wait longer for that to get back, for the pulse to get back. Therefore, on deeper depths, you have a longer pulse repetition period. So why is this relevant? Well, if you have a longer pulse repetition period, it affects the frame rate. When you go deeper, the pulse repetition period is longer and the frame rate is slower. Why is it slower? Well, when the machine creates the image, it's sweeping back and forth. Okay, that's the frame rate. How many frames, how many sweeps per second? When it takes longer for each one of these pulses, the frame rate is slower, and that results in a real choppy image. Here we are at a shallow depth. We're scanning around. At a deeper depth, when you're scanning around, it's a little choppier. It's kind of subtle. The scale here is a little misleading. In reality, the pulse duration is about 0.2% of the pulse repetition period. That's 2 1,000ths. So this would be 2 1,000ths of this. That's a duty factor, 0.2%. So this is 2 1,000ths of this. So in reality, this pulse repetition period would be way out here and in the other room. Okay, you get all that? To change the depth, you just turn the knob. Another thing that affects temporal resolution is focus. So here's an image using one focal zone. This little symbol here is where the focal zone is. The focal zone should either be right at the area of interest or just deep to the area of interest. So we're interested in the liver here. See, now we have 3 focal zones. And as you can see, the temporal resolution has degraded. It's kind of choppy, not as nice as it was before. However, when you freeze with multiple focal zones, you have higher resolution and it's focused throughout the image. So why does multiple focal zones cause poor temporal resolution? It decreases the frame rate. Why does it slow down the frame rate? Well, for each line, it has to pulse 3 times now, 1 for every focal zone. So that really slows down the frame rate. So this multiple focal zones has poor temporal resolution, but good spatial resolution, what we're used to calling resolution. So it makes a bad video, but when you freeze it, it makes a good photo. You control the number and location of the focal zones with this knob here. Okay, before we wrap it up, I'd just like to show you one last thing. There's nothing worse than when you come into the lab and you go to pick up the probe and the last person to use it didn't clean off the gel. Not cleaning the probe isn't just inconsiderate, but it's an infection control issue. So after every patient, wipe off the gel and then clean it off with a disinfection wipe. Okay, that about wraps it up. See you next week.